Hi, it's Menno, and this is going to be quite a depressing video about the practice of lopping off perfectly healthy breasts from the bodies of girls as young as 12 and 13. I'm going to use some language in this video that may not be the nicest, but I'm just done with all this gender fuckery, and I think we need to use language that is clear. So we're talking perfectly healthy breasts, girls as young as 12 and 13. When I mention this online or in real life, some people call me a liar and say, "It's not true." Yes, it is. I'll be sharing the evidence in this video, and it's not like I had to go digging around for it. It's publicly available.
We believe in amputation, even for the generation that hasn't even come of age. Mastectomies for minors, that is all the rage. Call us now for a consultation. Dial 1-300-GEET the teats.
The amputation of both breasts is known as a bilateral or double mastectomy and is normally a procedure for women who have breast cancer or who are at an extremely high risk of developing breast cancer. For most, it's a highly traumatic procedure that leaves deep psychological as well as physical scars. For a number of years now, these irreversible surgeries have been glorified as a way for stressed out girls with severe mental health problems to find their authentic self.
Don't dream it. Be it. Don't dream it. Be it. Don't dream it.
Of course, double mastectomy or breast amputation doesn't sound all too sexy, especially when you're targeting kids. So the term used these days is
top surgery
or the teat jeet. One Irish surgeon calls her team the D-Titty Committee, calls herself a tit wizard. And here is a surgeon all smiles as he poses with buckets of removed breasts. Sounds like a real savory business, doesn't it? But hey, it's legal! Welcome to the Wild West of
gender affirming
surgery. How do we know that 13-year-olds are having these double mastectomies? Here is a paper written by Johanno Olson-Kennedy, among others, who is the medical director at the Los Angeles Children's Hospital in California. Johanna is not a surgeon herself, but she is the one referring these girls for these surgeries. This paper is from 2018. It is a medical paper, but it doesn't use the words amputation or double mastectomy at all. Instead, it uses chest reconstruction. So even in a medical setting, they're trying to get away from the reality of what is happening. The paper is a strategic move by Olson-Kennedy to argue that slicing off the perfectly healthy breast from these young girls works wonders for them, and that age should never be a restricting factor in them being able to get these types of surgeries. In the States, there is no minimum age for these double mastectomies for
gender affirming
purposes, and Johanna is arguing that that is a good thing and using her study to make that case. This has nothing to do with human rights or with patient care. This is just about market development. How can you increase the size of your potential customers? It's business. The paper presents the findings of a study with two different groups of girls. Group 1, girls who were desperate to have their breasts removed and had it done.
Take my breasts away.
okay, done.
Oh, thank you so much.
Would you like to buy the t-shirt too? We have a great selection.
Group 2, girls who are desperate to have their breasts removed and are still waiting for their surgery.
Take my breasts away.
No, you're gonna have to keep yours a little bit longer.
What? Why? Just take them off.
Guess which group came out as feeling happier? From this table, we can see that the youngest girls in the study who had their breasts sliced off were 13. There were 2 of them. So, there you go. Don't tell me this isn't happening. It's right there in black and white. I'll link to the study in the video description. We can also see that there were 5 girls who were only 14, 9 girls who were only 15. So in total, 16 girls under the age of 16 in this particular study. The paper was published in 2018, so I'm sure you can imagine that a few more breasts have been chopped off since. Also in 2018, in May, Our Irish tit wizard claimed that she had performed 250 double mastectomies.
So full disclosure, in our patients, about 250 mastectomies. Out of those 250, we've had 2 nipples that didn't take.
She doesn't shy away from performing these double mastectomies on minors. In fact, she seems to be arguing the case that the younger the better. In a conversation this week that I had with a woman who thinks that she's a bloke, she had this procedure as an adult. She was unaware that 13-year-olds are getting their breasts sliced off in the name of gender. When I first pointed it out, she denied it. When I showed her the report, she didn't read it properly and still denied it. When I finally said, look at the graph, she said, okay, that's too young. So this is from a person who has had the procedure herself as an adult. So then I asked, if that's too young, then what's gone wrong for these 13-year-olds to have had these procedures? Who is accountable here? Who should have been stopped? At what point? Other people have said to me, oh, well, but it's just in the States. Yeah, so what? Lots of things begin in the States and then find their way over here. Other people argue, oh, well, they must have had a real thorough psychological evaluation. Yet no. We know that in the States they've been pushing this affirmation-only model for years. In a recent research study by Lisa Littman with 100 detransitioners, 55% of them said they weren't evaluated properly. Again, this is not about human rights. This is not about care for patients or individuals. It's market development. Money, 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 money. The girls dealing with all this distress, they need support. They need help. There are many complex psychological reasons that are underpinning them wanting to have their breasts removed. They need proper support. Now, in the words of Aretha, I ain't no psychiatrist, I ain't no doctor with degrees. But it don't take too much high IQ to see that the last thing you'd recommend to someone suffering from severe psychological distress, and who is 13, is irreversible major surgery. It is nuts. It's a crazy world we're living in. Then I heard people say that girls as young as 12 were having their breasts amputated. 12? So I said, okay, show me the evidence. Here is a clip filmed at the Gender Spectrum Conference, specifically at the Professionals Symposium, where Kellen Lockhart, who is a gender specialist, although I would say professional groomer would be more apt, admitting that at Kaiser Permanente Oakland Medical Center, they have performed double mastectomies on a girl as young as 12.
In terms of masculinizing top surgery, I think 12 is the youngest who's had surgery through our program. I think 12 is the youngest.
And look at the others, nodding like it's a wonderful thing.
12 is the youngest who's had surgery through our program.
We're led to believe that this person is male, but I have my suspicion that this is a female on testosterone. There were 7 speakers on that panel. 4 of them work in children's hospitals. One of them was Diane Ehrensaft, who is that crazy woman who thinks that if a toddler plays with their onesie in a certain way, that they're really sickling to you, that they're transgender and they'd rather have a spinning dress. These people are mad, but they're also running these services. Runner-up! In Canada, surgeon Marc Duperret, at his Visage clinic in Toronto, is happy to perform a double mastectomy on a 14-year-old girl, as long as the child is firm about her decision to transition. Please note the word child. So, there you have it. What about the UK? An article published in The Times last September showed that 51 teenagers aged 16 and 17 have been referred for
Gender affirming
double mastectomies in Scotland. What does WPATH have to say about this? The World Professional Association for Transgender Health. This is their Standards of Care document, version 7, published in 2012. That's 10 years ago now. Version 8 will be published spring 2022. This document uses the rather vague term chest surgery, although in other places it does mention mastectomy, but tries to reposition it as male chest contouring. Okay, so for genital surgery, they're saying that shouldn't be carried out until a patient reaches the legal age of majority. The legal age of majority differs per country, but that's basically when the law considers you to be an adult, which in the UK is 18. For double mastectomies, they're happy for that to be younger. And they're kind of saying, okay, preferably after ample time of living in the desired gender role, as in acting out sexist stereotypes, and after 1 year of testosterone treatment. However, in their criteria for a mastectomy, they make it clear that hormone therapy is not a prerequisite. They go even further when they say, however, different approaches may be more suitable depending on an adolescent's specific situation. They're basically saying, just take it on a case-by-case basis, just as Johanno Olson-Kennedy and South Gallagher have been saying, because that way you can justify performing a double mastectomy for
Gender affirmation
reasons on a 12-year-old. Okay, let's all sing along, everyone!
We believe in amputation, even for the generation that hasn't even come of age. Mastectomies for minors, that is all the rage.
To anyone who thinks this is a great idea for minors to have these irreversible major surgeries, I think you're
In terms of masculinizing top surgery, I think 12 is the youngest who's had surgery through our program.
To all my PayPal and Patreon supporters, thank you so very much. Special shout out to my big spenders, Help Her Open, Mama Turv and the Turvin Teens, Dark Horse, The Lovely Mary, Me Julie, Julia, and Stephanie. Thank you.